Hello all, welcome to Sakshi TV and welcome to your show Ask Your Doctor. Today we have with us Dr. Nupur Patel. She's a dentist in New York and she has been practicing dentistry from 2016. She was born and brought up in New Jersey, New York area. So please welcome Dr. Nupur Patel to our show.
Hi everyone.
Hi Dr. Nupur. Can you please introduce yourself and about your background?
Sure. My name is Nupur. I was born in New Jersey and I went to NYU Dental School. I graduated in 2016 and I've been practicing in general dentistry for about 7-8 years now.
That's nice. So can you tell us what are some of the problems that come up if oral hygiene is not maintained?
Okay, so oral hygiene is, everything to do with the mouth. Sometimes some of the problems that can happen is that you can have bad breath, you can have your teeth hurting, you can have sensitivity, sometimes you can have some self-esteem issue. So those are all the things we check when we go to the dentist.
So another main topic that is there are, especially in kids, adults, everybody are dental cavities, especially a lot in South Asian population. So I would like to know what are dental cavities and how can we prevent dental cavities?
Cavity is basically what happens is in the mouth you have bacteria, and the acid that the bacteria releases makes your tooth soft. So you get little holes in your teeth. If the hole becomes too big, then it goes inside of the tooth in the nerve, and sometimes you can have infection, you can have pain, and so it's like a problem. And when it's small, you can treat it in certain ways. You can do a filling, you can, it's more preventive. But if you let it go and sit for too long, once it starts hurting, then you're going to need to do something more extreme, like either take out the tooth or you can save it with the root canal. So some of the ways that the cavity starts to happen is if you have a lot of sugary foods, if you have a lot of starch, and you let it sit in your mouth for a long time, that's when you get more cavity increase. So if you're drinking a soda, if you're drinking coffee with sugar, any kind of tea, if you sip it for like 1 hour and then you don't wash your mouth out with that water, that's when you have a lot of the problem. If you're eating candy for a long time or juice with a lot of sugar, your mouth becomes dry, and that's when all of the cavities start to happen. So we usually recommend, if you have sugar, limit the time that you have it, try to limit the sugar, make sure you brush and floss, that way your teeth stay strong and healthy.
Brushing your teeth regularly and then, rinsing it with water when you eat a lot of sugar or something.
Especially if you have sugar, juice, soda, chips, everything like that.
That's good to know. Those are small things that we can prevent.
Especially for kids. So if they're drinking juice or something sugary, they sip on it for a long time. That's why the kids have a lot of problems with their teeth, sometimes.
Okay. Then the second most common in South Asian population is again gum diseases. So can you tell me more about it and the ways that we can prevent or to identify early stages of gum disease so that it doesn't become a big problem?
So gum disease can come from a few things. It can come from genetic, it can come from things like smoking. Over time, if you don't brush and floss, if you have too much plaque buildup, this is when you have gum disease. Gum disease is different from the cavity. It's more so like if you're brushing your teeth and your gums start to bleed, if your teeth are a little bit loose, you could have a problem with the gums. Your teeth are sit in the bone in your jaw, so sometimes genetic or sometimes over time the bone starts to go down and you have a pocket between your teeth and the bone. And so if you don't clean it well, your gums try to get rid of it on its own, and so that's why your teeth are bleeding and stuff. If you don't take care, then over time the teeth can get loose, and then you have to take it out, and there's not much you can do to treat it once it's gone too far. So it's very important to take care of it before it becomes a problem. So some of the ways you can take care of it is it's good to floss, especially if you feel your teeth should feel smooth. So if you don't take care regularly and you don't brush and floss, then you get like plaque and it feels a little hard. Once that's there, you have to go to the dentist for the cleaning, and after everything is clean, then it's good that you can, maintain that. So if it gets too bad, you might have to go see the periodontist or the gum specialist.
So is bleeding gums a good sign for like common people to know that they have some gum issues?
Yeah, if your gum is bleeding, it basically means that there's something inside the gum next to the tooth. So if you go to the dentist regularly and your gums are okay and then you have bleeding gums, sometimes if you floss it, within a few days it should go away. But if you have like more advanced stage of the gum disease, then you have to treat it a little bit differently. So it's good to know, when you're cleaning your mouth at home, if you notice a lot of bleeding, to check in and try to figure out what that is and what you can do about it.
So, and one more thing that covers in the same thing is, staining. There is like a lot of people have stains on their tooth and they use whitening, which are available, whitening creams or something like that, whitening paste and all. So, how good is that for like common people? Is it good to use them, or is there a limit that you can use them? I mean, you can think about it. I just thought about it.
No, that's okay. Yeah. So staining either comes from like eating the food that has like a lot of staining, or it can come from not cleaning well. If you don't clean well, then you get the plaque on your teeth, and that plaque is what retains a lot more of the stain. So if you want your teeth to look white, the main thing is, you make sure you clean it well. The best thing is to go to the dentist and have them clean it, because they use the different tools to clean the plaque. But if you're doing it at home and you have a lot of plaque and then you use the whitening, it's not going to work as well. It's good to do it regularly if you want to keep up with that. And then try to avoid eating stained foods, so that way everything can look clean and bright.
Oh, that's nice.
Also, smoking can give you a lot of stains. Tea, pasta sauce. So if you eat something, coffee gives you a lot of stain. Tea. So if you eat something like that, it's good to brush your teeth afterwards.
So one more thing that like in India and mainly is like we don't go to dentists that often, and we don't have regular visits like we have in America. In America, we have regular dental checkups and all. But in India, most of the thing is like we have a myth that when you go to a dentist, they get your tooth removed. So can you please tell us more, me and our viewers, more about what are the different ways that you can avoid your tooth getting removed?
I think that's the main thing, because when I see the patient that hasn't gone to the dentist 5-6 years, they come in and they have so many things, and once you hit that stage of, you feel pain and then you're like, oh, I need to go to the dentist, that's when it's bad. It limits the options of what we can do to take care of the tooth. So in America here, they say you should go to the dentist for a checkup every 6 months. So at least once a year, it's good. They will take the pictures of your teeth. They'll go over everything with you if you have any issues, if you have any cavities. When they're small, it's much easier to take care of it. If you have any gum problems, then they can go over it before it becomes too much of a problem. That's why at least if you can't go every 6 months, it's good to go at least once a year. That way, you can stay on top of it, rather than once it's a problem, it's hard to fix, So they have like many ways you can treat a tooth before you need to take it out. But if you go when it starts hurting, then the option is much more limited. Like either the hole is too big, so you might need to just take it out. But if it's smaller, you can try the root canal, or if it's smaller, you can try the filling. And that way, usually it's less expensive and it's much easier to do, and long term it's better. If you pull the tooth out, then what happens is that your teeth start to shift. So if you have a missing space, the ones in the back start to come forward. Sometimes it's hard to chew, so you start chewing on the other side, then you chew on that side and you have the problem. So if you don't manage, then it's much harder to keep your teeth strong for a long time, you know.
So what are the other options if your tooth is removed? Are there any other options that is possible?
Yeah, so if you take the tooth out, you can replace it. Usually you can either they can put like a bridge, so they'll use your side teeth to fill in the missing space, but nowadays everyone here is using implants. Implant is a very good option. They use like biocompatible metal, and they place it in the bone, and then they put a tooth on top of that after everything heals. So if you're not smoking, no diabetes, no hypertension, the success rate of that implant is good, like 96%. That way, you know, you're chewing and functioning like normal, you know, up until your late age with all your teeth.
Oh, that's good to know. That option is definitely useful for a lot of viewers. Second thing I want to talk about is what is oral cancer and how can we prevent oral cancer?
So oral cancer is one of the most dangerous kinds of cancer only because it goes very fast. Usually oral cancer starts from like smoking. Sometimes it can also happen randomly. But the main thing is there's so many types of oral lesions to look out for. You can have a fungal infection, bacterial infection. It's good to kind of have an awareness of what's going on in your mouth. If you notice any change, any bump, any ulcer, it's good to get it checked out, even though it might not hurt. If you notice any white film, it's good to have an idea of what it is, because sometimes, you know, if you have an issue in your body, it can present itself in the mouth first. So it's good to know that. And then cancer is one of the worst one in the mouth because it moves so fast. So if you notice on your side of the tongue, if you notice any kind of bump or anything, it's good to get it checked out and taken care of before it progresses, because sometimes, you know, it can move so fast that you can, you know, pass away early.
What is Invisalign, and is there any age limit for the viewers to use Invisalign? And I would like to know more about that.
Sure. So Invisalign is like a form of braces. So they have the metal braces and they have the clear braces. Here, Invisalign is just a name brand of braces, but now newer companies use, and you switch out the trays to straighten out your teeth. The main issue with the clear aligners is you have to be very, very strict with like how you wear them. You can only take them out when you eat. You have to wear them 22 hours a day, versus the metal braces that they glue to your teeth. You can't take them out, you know? So for kids, sometimes, unless the kid is like really responsible, the metal braces is much easier because they have to do it no matter what. But in terms of age, you know, we have patients from like 18 to like 70 who are using Invisalign. They just want to straighten their teeth. And then depending on like the complexity of the case, if it's simple or if it's a little more complicated, you can wear it for like a year, or it may take a few more years.
This is one more thing, like back in India, we don't get our wisdom tooth removed. But in America, I have seen like a lot of dentists, they do recommend to get our wisdom tooth removed. So how important is this? Or is it by choice? Or
it's, I think, more of a case-by-case basis. Here it's preventive. So what happens, the reason that the wisdom teeth become an issue is if you have a cavity on the wisdom tooth or it's coming in at a weird angle, it can affect the tooth in the front. So for us, it's hard to do like a cavity or a filling on that wisdom tooth because it's it's in the back. So when we're like 18, 19, we recommend, you know, go for the evaluation if you need to remove it. You're young, you can heal up much better, so that's why we do it a little when you're younger. But if you know, go to the dentist and you see the doctor will see the x-ray, they can give you a better idea of like, you know, maybe this, if your mouth is big and you have room for the wisdom teeth, it's okay, you don't need to take it out. But if it's smaller, the wisdom teeth come in, they can cause your teeth to shift because there's coming pressure from the back. You can, like I said, you can have the cavity and then it will pass to the tooth in front. So case by case. But it's good to look at, you know.
Oh, that's good. yeah, these are the things that we generally have, and so I thought it's good to ask you when you're here. Finally, would you like to give any advice to our viewers on better oral hygiene or in general?
So I think oral hygiene, the best thing is like brush 2 times a day. For some people, if you have the gum, in my opinion, the electric toothbrush is very good because it helps you clean all the way in the back. Mainly you have a lot of plaque between the bottom teeth behind the tongue. So, you know, that helps. Flossing is good, and then depending on like how your visit goes with the dentist, like sometimes one of the problems is, you know, you don't want to brush too hard. Just like small light strokes, because sometimes if you brush hard can cause other issues with the gum. So make sure you're brushing lightly, using a good toothbrush. I think flossing is very important, but it depends. So like if you have the gum problem, it's really important to floss. For kids and stuff, it's sometimes hard for them to floss, you know, regularly. It's more important for them to at least take care of the brushing and also cleaning your tongue. A lot of the bacteria that causes bad breath, it sits on your tongue in the morning, so sometimes people forget. In India we use the tongue scraper. It's the best. Here they don't do that.
Yeah, that's right.
So it's good.
I love those metal ones.
The copper is really good, so that helps a lot with the bad breath. But if you have the gum issue, they have like a water pick now, and it's a little bit easier than flossing. You just like clean. So I think if you regularly spend some time keeping it clean, it's good. You know, your breath smells good and you feel good and your smile is white. The whitening is another thing you can do regularly, you know, just so too much stain doesn't come up.
That's really nice. Thank you so much, Dr. Nupur. It's really a pleasure to have you in our show today. Thank you.